special welcome to another exciting episode. Today, I am super excited to have Dr. Meha join me all the way from India. She is an artificial intelligence and machine learning consultant in the healthcare. I am just so excited to get into the conversation with her because she brings quite practical knowledge and just information as to what is happening on the ground in India when it comes to AI in the health space. Dr. Meha, welcome to the podcast.
Thank you so much, Sarah. Thank you so much for lovely introduction. Thank you.
Let's start this conversation by having you introduce yourself to the audience. Just tell us who you are and the career journey that you have walked to get to where you are today.
Okay. Good afternoon, first of all. And I would like to mention that my journey started from very small backward area, basically jungle and farms. I have been raised in such a way. But yeah, consistently motivated by parents and family, I managed to reach to this designation right now. And yes, so basically, I'm a dentist. I have practiced for few years. Then I have also worked as a scientist at under one government sector unit. And then I have been working as a project manager for this healthcare IT company. Currently, I'm working simultaneously. I'm also working as AIML healthcare consultant. So this is how it is so far.
Beautiful, beautiful. So, the one thing I like is just how you have pivoted your career from being a dentist to being a consultant in the artificial intelligence and machine learning space. And I also know that you're an educator in this space. Do you just want to tell us a little bit more about, how you've been able to pivot your career from being a dentist to being an artificial intelligence and machine learning consultant?
Yeah, so my passion for artificial intelligence and machine learning in healthcare stemmed from recognizing its transformative potential, witnessing the impact that data driven insights and automation can have on patient care and outcomes ignited my enthusiasm to learn, more about AI/ML. The prospect of improving diagnostics, treatment plans, and operation efficiency through advanced technology inspired me to drill into the intersection of healthcare and artificial intelligence.
Beautiful, beautiful. I know that you're a mother as well. And before we started recording, we did talk about the fact that artificial intelligence is actually giving us a lot of space in terms of being able to free up more time for us to be able to do the things that we love to do, but also things that we are called to do, like motherhood, for example. And you did talk about the fact that initially you also owned dental clinics that were quite taxing on you. Do you just want to talk to us about that side of your life as well?
Absolutely. So, as I mentioned off the camera, we were discussing about my practicing journey and this and that. So, my clinic was in rural area actually. So I had a few of the clinics, total three. So two were into rural area, urban area actually, developing area, and one was in the tier three town of India. So these two clinics, which were situated in rural area, that were having like quite a lot of patient. So patient input was too much. So while dealing with the patient relatives, explaining them treatment plan, and post procedure instructions, that was quite a lot. So because of that, I faced quite challenges. That was the time when I realized that these kind of some kind of assistance would be big help. So Yeah, so that was the time when I started reaching out, to further upgrade myself in terms of technology, software, things like that.
Beautiful, beautiful, beautiful. And obviously, the coming in of artificial intelligence gives us more time on our hands, because then, you get software robots that can actually help you with certain things. I actually loved the concept that you brought to the conversation when we were talking. The fact that as a medical practitioner, you really don't have much contact time with people when you've got so many lines of people waiting to to see you, and for you to attend to them. But with AI, doctors can actually be freed from spending time in on mundane repetitive work that can actually be given to a software robot and so on to work on, so that they can maximize their contact time and their care time with their patients. Do you just want to speak to us how you are seeing artificial intelligence and machine learning uh, playing a part as a healthcare assistant, or as a tool that is helping healthcare personnel to be more efficient and to be able to give better healthcare service to the people that they are attending to?
So, am I correcting it? Am I connecting it right when you say about these things? Are you asking about the examples of use of artificial intelligence in day-to-day life or healthcare sector? This is what you're saying.
Yes, yes, yes. So let's look at the use cases, like in everyday healthcare practices. How is
Okay.
artificial intelligence being used by medical
Okay.
personnel, specifically in India?
Correct. So, as I will start from there, where I was practicing, these kind of facilities, assistants were not that common. That was, under development, I would say. This I'm talking about 15, 16 years back. But now it has been reached to grassroots. Let me put some of the examples. Like artificial intelligence has been integral part of our day-to-day life now, whether we accept it or not, directly, indirectly, we all are under observation of AI/ML. So some of the use cases, actually very good use cases of AI/ML in healthcare industry in India are like, first example, I would say about the assisted or automated diagnosis and prescription. Under that comes the chatbot. You might have heard about the chatbots. Okay, so chatbots can help patients self-diagnose or assist doctors in diagnosis. So there are multiple type of chatbots are there we are using in our day to day life. Second is prescription auditing. So that is AI audit system can help minimize prescription errors by checking for drug interactions, doses errors, and patient allergies. And third use we are having, that is pregnancy management. So AIML can monitor the mother and fetus to reduce the mother's worries and enable early diagnosis of any complication in fetus. And also we are using it as a personalized medication and care. Like AIML can help users to find the best treatment plan according to their patient data, reducing cost and increasing the effectiveness of care. So these are few examples which we are using in healthcare sector in day to day life right now.
That is absolutely inspiring, that you guys are so far way ahead with just the use of machine learning and artificial intelligence in the healthcare. But I want us to break down this conversation for an everyday person, who is sitting wherever, who even does not understand how artificial intelligence works and what artificial intelligence is. Before we come to that definition, let's just get into the use cases that you have highlighted. So, when you talk about doctors using the chatbots, in their care for the patients, can you just sort of break it down to us? What does it look like, in a practical sense? How are they using the AI chatbots practically? You can talk to us both from the medical personnel's perspective